All right. Welcome, ladies. Thank you so much.
Thanks for having us today. My name is Brooke. Like Cheryl was saying, I am the manager of our psychosocial services at Pathways, and I will share my screen and we can get started. Feel free to ask any questions that might come up. I'm happy to answer anything that comes up. So, who are we? We are Pathways Grief and Loss. Pathways in the community has, I think, most of our reputation is around hospice care, but we offer so many parts within the Pathways umbrella. So, we have our hospice supports as well as our palliative supports, and then we also have a grief and loss center. So, we support our families in the Pathways Grief and Loss Center for families who've lost a loved one on hospice. But we also support community members who want to access grief counseling. So it's a little bit of mix both within our hospice services and out in the community. And so that is a way that we're able to navigate that. How I kind of fit into that bubble is really I do a whole bunch of different things. I wear a bunch of different hats. And so I get to support our bereavement services, so our grief and loss center, where we have our grief counselors, as well as on hospice and palliative. I get to support our social work teams, our chaplains, and our music therapists. So a little bit of all of the pieces that go into focusing on holistic care. So today we're going to cover quite a bit of things. So feel free to jump in, make it more conversational as you feel comfortable. I'll also have a little space for questions and answers at the end. We're going to go over myths about grief, types of grief, a little bit of theory around grief, just to give us some framework and some language around grief, how this might show up, some coping strategies, perspectives and kind of wrapping that around with grief in the community and resilience. So, our first part here is just kind of an understanding of what is grief. This is the definition that I just got off of Google, because grief is so much more than what we can put into a sentence. It says that grief is the emotional response to loss involving feelings like sadness, longing, and adjustment to life without what's been lost. But we also know that grief holds so many pieces, not just a primary loss, but many secondary losses, changes in roles, changes in family, changes in dynamics. So many parts are involved in just the word grief. So, why is it important to understand grief? It helps foster empathy, resilience, and healing, both individually within ourselves and collectively. Such a big part of grief is being able to be seen and heard within our grief process, and finding community within grief. We'll talk about that as we kind of move through the presentation. So we start out with myths about grief. I think it's always important to call these out because we often hear a lot of different narratives around grief, and it is helpful to kind of understand just the language. Our kind of Western society doesn't talk a lot about grief and doesn't give us a lot of the language around grief to be able to communicate it. So our first myth that we have here is that grief and mourning are the same experience. Does anyone have any thoughts about that first myth? If not, that's okay too.
I kind of thought they were the same. I mean,
Yeah.
I kind of put them in the same bucket.
hmm Yeah, we often use them interchangeably, but grief is really our own internal process, whereas mourning is the outward externalization of grief. So it's kind of like our behaviors, it's crying, it's engaging in our outward expression, where grief is really the pieces that we are internally navigating through sadness, through depression, through anger, through a lot of these different pieces. And sometimes I think it's helpful to be able to recognize and give some language around that. And then our second myth here is that
Real,
there's a predictable, oh,
I just want to say that I share the same view as Cheryl just now. And if they weren't the same, I certainly saw them being strongly interconnected. And I'm wondering, with all due respect to you, and this comment is not meant to be inappropriate in any way, but I'm wondering if we would look up some definition somewhere and that they would show them being interchangeable. You raise a very good point. I just never saw them being separate. Thank you for listening.
yeah. Yeah, I think it's a great point. We do definitely use mourning and grief very similarly, and I would agree that they are very interconnected. Um, but I think it's helpful to be able to have some definitions, to be able to give words to what we experience, because we're so often we so often put grief in such a box that it's hard to understand. And so a lot of times within grief and how I communicate about grief and how we talk about grief is finding a framework that works for you to be able to understand your experience. Because what might fit with one person or one loss might not be the same for your next loss or your next experience in grief. And so I'll talk a lot about that of being like, if this fits for you, that's great. If it doesn't fit for you, that's okay too. Because we're trying to give words to a human experience, which is just not something that we can do, right? Like it's a part of who we are as humans and what makes us so complex. So thank you for bringing that up. We can definitely look up some definitions and maybe send that out after. We could totally do that. So myth two is that there's a predictable and orderly progression to the grief experience.
Hmm. No, we're saying no here.
Hmm. Yeah. I think this is definitely a big myth. I think we'll talk about the theory that really kind of brought this myth into a lot of our language around grief, which is the stages of grief. I have a whole slide on that. But we know that grief doesn't go in stages or there's a predictable and orderly progression. We know that it's not linear. And I think it's important to be able to recognize that and name it, because we are often familiar with the stages of grief, and there's a lot of misconceptions around that. Our next myth is that it's best to move away from grief and mourning instead of towards it.
Yeah, you definitely need to work through it and dive into it. 'Cause I heard a quote once that said, it will find you, even if it's 20 years later.
Hmm. Yeah, it is something that we walk alongside grief, if that fits for you. And it follows with us. It comes with us through so many different experiences, and without recognizing it and being able to name it and talk to it and work within grief, it will pop up, whether it's 10 years later, 20 years later, a month later, whatever that timeline might be, and you never know what it's going to be that straw on the camel's back that breaks into that grief experience for us. It also makes me think a lot about the narratives that our society tells us about timelines of how we feel about grief. And one thing that kind of always sits with me that as we've worked throughout our lives, um, we had what's called bereavement leave. And that most of the time was 3 to 5 days. And that was what we get from a employer side of this is how we package grief, right? So we can experience grief for 3 to 5 days, and then we need everyone back at work to continue on with the routine. And we know that's not how grief works. Um, Myth four is that tears expressing grief are only a sign of weakness. Sometimes
Right.
our society tells us that crying can be really difficult to be present with or to express ourselves, where tears are often an expression of grief, of love, and being able to welcome the expression and the emotions around grief that we're feeling. And then myth 5, the goal is to get over, quote unquote, your grief, which we kind of touched on a little bit already. But the goal is really to name grief, be able to explore grief, experience it, and learn how to navigate through and with grief. So what is this giant word of grief? There are so many parts of grief that we try to name, and these are just 4 that we often see. So what we typically see within the grief experience is what's called normal or expected grief. And then this is what usually involves the experience of sadness and longing, the ups and downs that we experience from the loss of a loved one, or just a loss of transition or role that we might have. We also have complicated and unresolved grief. This is really where we're seeing that grief process be prolonged with more intensive symptoms of grief that can affect our daily lives or our daily routines. And this is where we usually see the need for a grief center, because we as a grief and loss center and within the grief space, usually we are seeing complicated and unresolved grief because it is this prolonged, intensive emotion that we are navigating, where we really need some skills and some exploration within the grief process. We also see anticipatory grief, which is really in kind of our hospice setting. It is the anticipatory grief before a loved one passes, where we are grieving that loved one before that happens. And so it's a response to an expected loss where we are navigating all of those feelings, but beforehand, which can also lead to maybe 1 or 2 of the either normal or complicated grief processes, depending on how we are able to navigate and move through that process as well. And then we also have disenfranchised grief, which is characterized as over a loss that society may not recognize or validate, often due to the nature of the relationship or circumstances surrounding the loss. So that can be, for example, if there is a friend where we have lost the friend and the memorial service was only family and we were not able to participate in that, it can make that lead into disenfranchised grief because that your grief is not being seen or heard in that process, and you're being separated from that grieving process within the community of grief, within that care team, within those loved ones. And so that can be leading into some of those complicated grief processes as well.
So Brooke, if I could ask, with the disenfranchised, would you consider the loss of a pet under that? Because I think that sometimes people don't understand that, even if the pet isn't a normal pet, but something that you've attached to that has become your family member.
Yeah, I think that's a great point. It's where that the grief process is not always recognized or validated. And so if it's not being seen by your community of loved ones around you as working through this grief process, it can totally go into disenfranchised grief.
Yeah.
Absolutely. Mhm. Great point. Thank you. So now that we know the types of grief, I think it's important to understand maybe some framework that we can learn about grief and have some language or processing to be able to give some language to it. So I talked a little bit about stages of grief. These are the stages that were developed by Dr. Elizabeth Kubler-Ross. And so these are denial, anger, bargaining, depression, and acceptance. Um, Dr. Kubler-Ross developed this theory and model working with patients who were dying of AIDS. And so this was more in the anticipatory process of grief, where she was able to define and give language to certain stages that people were experiencing through the dying process. And so over time, a lot of times we've seen this be linear, but a lot where we kind of dive into this is being able to give framework or language around grief. So we might not hit all 5 stages if this framework works for you. Um, or we might just be in anger and then go to depression and then back to anger and then back to depression. And we might not ever hit denial and bargaining. I do think some of the language in the stages of grief can be really difficult when we are actively grieving, like the word acceptance. And so sometimes it's about reframing these words into something that really fits for us. And a lot of times I talk about acceptance and change that into a recognition of the facts of the passing. Um, and so being able to find something that might work for you in that stage can be really helpful. Um, Rather than being like, I don't accept this death, but I can recognize that it has occurred. And maybe that's the stage of quote unquote acceptance. Um, I think also the word denial tends to get a bad rap. It has a certain connotation associated with it. But denial is really a space within grief that is a survival response. When our regulation, when our emotions, when our systems are so overwhelmed with what is occurring because we are experiencing trauma, our brain goes into this place of denial. And how I like to think about that sometimes is having it be like a candy coated layer over our brain. But that candy coated layer doesn't always stay. It slowly breaks through, breaks down. And that's when that grief really starts to hit in. But denial can help us navigate through some really difficult spaces where we're not ready to quite process yet. It's just knowing when that denial can potentially be potentially harmful for us to stay in that space of denial. But it can help us in that survival stages, especially right after a loss, to be able to make sure that we are eating food, that we're drinking water, that we're sleeping, that we're communicating the pieces that we need to. Those can all lend to the space of denial. So just knowing that not everything has necessarily the same connotation that we're always used to in grief. And knowing that it's messy. A big theory that we talk about within grief, um, and how we kind of name this human experience is the dual process model of coping. And this is a picture that's associated with the dual model process of coping that can help us give some language and some permission within grief to feel what we need to feel through this process. So on our left-hand side, we have loss oriented. This bubble is really when we are feeling our grief. When we're in our grief work, we are crying, we are navigating those kind of waves of grief that are coming through and really feeling those emotions. And then we also have on the right-hand side what's called restoration oriented. So this is where we are doing new things, that maybe we have a distraction from grief, that we are working on like our new roles, our new identity within grief. Because when we experience a loss, we are inherently different. And so it's really kind of figuring out like who am I now after this loss, after this change, is more in that restoration oriented space. We know that you don't move from one to the other. It is an oscillation. So the dotted line back and forth between these two bubbles is really what grief can be. So we can be in restoration oriented, go into loss oriented, back and forth, and we might like cycle between restoration oriented and loss oriented every hour, every couple minutes, every few days. And so this model really gives us permission to feel how we need to feel in that moment and really meet ourselves where we're at, which can be really helpful in our grief processing. I think about this model of coping with sometimes like commercials or TV shows where we can be watching a TV show, we can be in restoration oriented because we are being distracted from our grief. And then as we watch TV, there's a commercial that comes on that plays a song that reminds us of our loved one. And we begin to cry. That goes immediately into loss oriented. And then the TV show comes back on, and we are then distracted again from grief and back into restoration oriented. So that's how fast we can cycle between these two bubbles. Any thoughts about this dual model process? Sometimes this really helps give some language or some understanding around grief, but sometimes it can be a lot to take in.
Brooke, I think it's an excellent graphic, and Sherry Thornton might be familiar with the term too. It might even be an interesting factoid, but it's beautiful the way it's laid out, and the oscillation piece in particular. I've certainly never thought of it that way, but it's just an excellent way to depict grief and what people are going through. Thank you.
Yeah, thank you. This is definitely like a space that I think resonates with a lot of people because it does give you permission to be back and forth, to be able to be restoration oriented, because sometimes that feels scary in grief. And sometimes it can be the opposite, where being in loss oriented can also feel scary. And this gives you permission to feel how you're feeling and know that that's okay. It's honoring your grief experience is truly where it comes from. So the next part is how grief shows up for us, the symptoms of grief. We like to talk about this in a pie chart model that we're a very visual. I guess I'm a very visual person, that this helps me kind of process and give some places into understanding grief. So within this pie chart, there are thought processes, feelings, spiritual behaviors, and physical symptoms of grief that we can break this down into. And sometimes it's helpful to take this pie chart or find a pie chart and break it down into these pieces and put the symptoms of grief that you have experienced or that you are experiencing within this space. And then on the flip side, have the other side be how we cope with these symptoms of grief. Because we experience part of grief within our thought process, a symptom of grief is what we call grief brain. And it is a term that kind of just gives language to like the confusion, the struggle to think through our thought processes when we are actively grieving. I kind of think about it similar to how it was communicated around like COVID and the COVID brain that was talked about pretty widely. It's very similar as like grief brain. We struggle to remember. We can get confused. We can just feel really lethargic. All of those pieces go into grief brain. So it's like, oh, I used to remember so many pieces and details, and I'm really struggling to do that right now. That is a normal symptom of grief that we experience. Within our other thought processes, it can be similar to when we walk back into our home and it's like, oh, my loved one is just in the other room. That thought that crosses our brains. that can be a symptom of grief as well. Our brain trying to be like, our loved one is still here with us. Or some of that denial piece can go into that thought process of a symptom of grief. There's also physical symptoms. Physical symptoms are things like headaches. We feel a lot of our tension, a lot of grief within our shoulders that can feel really tense, our lower backs. We also see a lot of chest tightness within grief, with the physical sensation of our heart breaking, and just tension around our chest and our heart. That can be a symptom of grief that we're experiencing. It's just manifesting in a physical manner. It can be lethargy. So when we're just feeling so tired that we just want to stay in bed, that we can't rest. And it can also be the opposite of that, where we can't sleep, where we can't feel like anything is restful. And knowing that all of these symptoms of grief can look differently for each person. So like the physical parts of it, sometimes we see in grief a lack of appetite. So I can't eat, I don't want to eat. So we're just not eating as a symptom of grief, where someone else might be experiencing overeating and finding a lot of comfort within food. And so that can be such a huge spectrum within the symptoms of grief, which is such a huge part of recognizing how this shows up for you and honoring how this shows up for other people that are experiencing loss. Because it might be a similar experience, but it could also be the complete opposite of how you are experiencing grief as well. And such a big part of the process is honoring and respecting your grief journey as well as the other people that are experiencing grief as well. Within the spiritual spaces of grief, I always like to name this question of who am I now? It's such a big part of like identity within spirituality. It can also be finding comfort in spirituality or religion, but it can also be anger within spirituality or religion. So there's such a spectrum within each of these aspects of our symptoms of grief. Within behaviors, we might see changes of routine. So struggling to maintain the routine that we had before the event of grief. It can also be developing new rituals, such as like visiting the place of death or of remembrance. It can be a focus on an object, of creating a ritual around an object, or just a ritual around the home. So just a place to be able to remember and honor. Or it can be avoidance as well. So there's so many parts of this, and being able to recognize how it shows up for you. And that's a big part of what we do within grief and loss supports, is being able to identify how these symptoms are showing up for you, and being able to then navigate that. Because a lot of times we see people and we experience new symptoms of grief with each type of different loss that we might experience, and being able to honor that where we are and know that that can be a symptom of grief. Some factors that might influence the grief process. So these are in 3 buckets that we put them in. Just to note, this is a very small list of a very extensive number of factors that can affect the grief process. So we've broken it down into 3, but there are so many things that could be included in this as well. We have the first factor influencing the grief process is the bereaved person. So our personality, our culture, our previous coping skills, our gender, and our age all factor into how we process grief. I think a big thing to also put on here is our previous experience with grief, as well as any traumas that we have experienced prior. That can change how we navigate and cope through grief. And just knowing that based off of, we can have family members that are experiencing the same loss, but based off of the person and these different aspects, they could be experiencing it very differently. We have the death event, which is a big factor in the grief process. So pieces within this can be suddenness, preventability, type of death, and decline. So when we see a sudden death, the risk of complicated grief can increase. Whereas if it's more of an expected loss, there's that anticipatory grief that we're kind of navigating prior, which gives us a little bit more, less in likelihood to experience complicated grief. Not to say that we wouldn't, but it's just kind of a factor within that process. And then the person who passed. So the relationship with this person, their personality, culture, coping skills, and age, those are all different factors that could be a process in or affect the process of grief. So someone who passes when they're young versus someone who passes later in life, that age can affect our grief process, as well as if we lose someone who is of similar age to us, that can also be a big factor in the grief process. So knowing all of these pieces around grief, how do we have the coping skills to work through and work with grief? So a big part is what we talked about stemming from the dual process model, finding a balance between grief and healing, the being and doing, the loss-oriented and the restoration-oriented. And also from this space, being able to acknowledge what your grief experience is for you. Honoring your own process within this and allowing yourself to feel how you feel, because that experience is totally valid. And being able to express those feelings and explore those feelings is such a big part of coping with that loss. We talk about self-care, those coping skills, going back to that pie chart, making sure that we're able to navigate some of the pieces, especially if we're having grief brain. It is an easy place to be able to be like, I'm experiencing a physical symptom of grief. I'm going to go to my coping skills pie chart, and then it's going to tell me what I need to engage in to help me navigate and support that physical symptom of grief. I've seen it be super successful for people if it lands for you. We also talk about fluids, exercise, rest, nutrition, and supports. One of the previous grief counselors here at Pathways kind of just capitalized all of them and named it into ferns. And so it's like kind of planting and making sure that we're taking care of all of these basic needs that we need to make sure we're engaging in. Knowing when to reach out to support or just to reach out for help and support. Grief is so messy with how it might come, or show up for us, given the fact that there's different frameworks, different structures of what we're experiencing, and that one grief experience is different from the next. It is always helpful to have a place for you to be able to talk about what you're experiencing, whether that's one-on-one or within kind of a support group. Having community and connection within grief, being able to share your grief experience helps the trajectory significantly, being able to navigate through and with grief. Knowing that in that grief process, there are going to be really difficult times where those waves of grief are even stronger than what we might experience on our typical quote unquote day. So knowing that whether it is if you have someone that you have lost on a Thursday afternoon, that Thursday afternoons tend to be a place where like I might feel more tension in my shoulders, or I'm struggling to, I'm engaging more in that grief brain, that I'm a little bit more confused, or I'm struggling to remember all of the details. That can be our body remembering that trauma on that hour and that day. That can be a weekly, a monthly, a yearly basis. And knowing that some of the celebrations or holidays that we might have celebrated with that person are likely going to be more difficult, and being able to engage in making a plan for maybe that this holiday needs to look differently. Maybe I need to create a ritual to be able to honor and remember, and being able to approach a holiday or a celebration a little differently than you have previously. We tend to see an uptick in grief symptoms at that year anniversary, definitely. So just kind of keeping in mind some fluctuations and our symptoms of grief that we experience. And then we always put in here trying to avoid unhealthy ways of coping, knowing that there's a spectrum of all of the ways that we cope. And so it can be like alcohol, where maybe taking that edge off it's technically a coping skill, but it can lead to a very unhealthy coping skill. So knowing when things tend to verge on unhealthy for us, and that can be true for so many different pieces, whether that is eating, whether that is activity, just kind of being mindful of how we're showing up for ourselves. So, how do we help someone through grief? We always want to offer empathy and validation, and increase awareness. The more that we talk about grief, the more that we're able to spread the language of grief, because it really truly is like its own language that a lot of times we haven't learned. In our society, we typically don't learn the language of grief until we're actively experiencing it. And so that makes it difficult kind of to jump into that experience without the framework or the language to navigate it. So the more that we can talk about it and increase our education, the more helpful it is to be able to give language when we are truly experiencing that. We want to be able to provide practical support, saying, how can I help? Or being able to identify needs that can be helpful when we're experiencing grief. Whether that's like, hi, like calling up the person who's experiencing grief of being like, I'm going to bring over dinner today and tomorrow. Or when someone asks, how can I help? Of having a list of activities around your house, or apartment or living area that someone can help with. So it takes off that pressure, because the how can I help is usually what we get, and then it's like, I don't know what I need. And so being able to just know I need groceries, I need food, I need my laundry. Having someone to help with some of those pieces can be helpful. Encouraging the expression of emotions is so powerful within grief, of being able to have someone where you can be present for, or if you're experiencing grief, have someone who can be present for you, that can sit with you in your grief. It's such a huge part of navigating grief, is being able to be seen and validated within that process. We want to avoid cliches or minimizing the person's feelings. We have a lot of phrasing around grief, that has the best intention around grief, but sometimes can make someone's grief process feel not validated. Um, and so being mindful of the person, and if that language is going to be helpful for them. Some language that sometimes I see is, well, everything gets better with time. Sometimes when we're actively grieving, that can feel minimizing, because it's like, I feel hurt, I feel grief now. And I want that to be recognized and honored. And so being able to just name what someone is feeling can be powerful. And go into respecting their unique grieving process. And so being able take a step and be able to look at how we are grieving, and it might be different than what we thought. We might be quicker to anger, quicker to frustration, quicker to tears within our grieving process, and being able to honor and support our loved ones through that. And being able to recognize that this might be a symptom of grief can be helpful in terms of maintaining those relationships, because grief can change relationships that we have as well.
Brooke, if I can,
Yeah.
a couple questions on helping someone through grief. You talked about language of grief, and can you talk a little bit more about that? And maybe that's probably avoiding cliches might be part of that language, but it always feels difficult to come up with the right language, or not say the wrong things. So what there's a language of grief, but what can you just dive into that just a little bit more?
Yeah, definitely. We definitely want to avoid some of the cliches and those kinds of pieces. And just saying, I'm here to help. I'm here to be with you. I'm here to recognize your grief. That can be extremely powerful to be able to meet someone where they are within that grief process. And also, we are always going to say things that maybe don't land with people. But being able to say, I don't want to say the wrong thing, but I want to communicate that I'm here for you.
So sometimes less might be more.
Yeah.
Listening
Yeah.
might be more. Just listening. I'm here for you, and just listen and just be there and be the broad shoulders for them. So yeah, not trying to work hard at finding the right words, which can get stumbled sometimes or say the wrong thing. So less sounds like less might be more.
Yeah. Creating a space for someone who's actively grieving is can be difficult, and it can also be healing. And having them use that space for what they would like. And also asking if someone would like to share what they're experiencing through grief. Can be helpful because it's such a powerful emotion and an overwhelming emotion. And when we are grieving, a lot of times we want to talk about that grief and the experience, the remembrance of our loved ones. And we do a lot of that at that initial stage of grief when we're engaging in like memorials, when we're engaging in funerals, all of those pieces, we talk about these memories of our loved ones and all of these like beautiful moments and difficult moments. But after those, being able to still ask about the loved one, or being able to say, would you like to share with me what you're experiencing, or any memories that you have that you would like to talk to me about today, and engaging in that process. Because when we lose someone and we do the process, and then sometimes we 4 months later, 6 months later, we're not always asking about the loss of a loved one, or that family support or the friend support might kind of taper off a little. And being able to still honor and support someone who is still grieving and create that space is so helpful. Because when we're experiencing loss, we want to talk about our loved one. We want to talk about the beautiful memories that we have. We want to create a place where we're still able to remember and talk, not a place where it feels like we're not acknowledging, if that's helpful.
Yes, thank you. Thank you.
Yeah. Mhm. There's also multiple cultural and religious perspectives on grief that can go into the grief process. So there's variations in grieving rituals and customs, beliefs about the afterlife or the meaning of death. And it's important to understand and ask what the importance or what the information or the beliefs or the rituals for someone are, to be able to have cultural sensitivity and respect, and be able to support people in their rituals, or their belief systems where they might find comfort. So how do we navigate grief in the community? We want to foster open communication. We want to create that space to talk about grief, to build community, to build connection. We want to have ongoing education around grief and language and structure. Continued check-ins and support are always helpful. Acknowledgement of the grief, being able to name it, respecting each person's unique path in our own process, normalizing access to additional supports. So support groups or therapy, that can oftentimes feel really scary to access therapy or access support groups, and being able to normalize being able to engage in that process can be really helpful because there is such a community aspect of support groups, and it's such a powerful place to be able to have a space that's just for you within counseling. And education around grieving practices as well. And what does that all build? It fosters into and streamlines into resilience. And so I included the definition of resilience here. It is the process and outcome of successfully adapting to difficult or challenging life experiences, especially through mental, emotional, and behavioral flexibility and adjustment to external and internal demands. That is definitely textbook resilience. I like to think about it in a visual way. Again, I'm a visual person, but it's the tree that bends but doesn't break. That is what resiliency is to me. And so when the strong winds of grief come and we are bent, resiliency is being able to then return back to standing after that windstorm. It is the support that we might need within structures that help us stand or be able to bend, but never getting to the breaking point is the fostering of resilience. And the goal within that is to be able to find meaning and loss, being able to create ritual, be able to create honoring and remembering. We want to rebuild a sense of self and purpose, and honoring the memory of our loved one while being able to make steps of really identifying who am I now and being able to hold strong to our identity. So resources that are available within grief as individual therapy, couples therapy, family therapy, lots of different types of therapy modalities, to find something that really lands with you, support groups and therapy groups. And then I always talk about the crisis line. I think it's really important. It's 988. You can call, you can text this number. You just can put it into your phone. It's the crisis line. And I always note that crisis is self-defined. It can be when things are just feeling incredibly overwhelming, and it's 2 a.m. and I don't know what to do, and I just need someone to listen, to talk to, because that feels overwhelming. It can be if there are pieces where we are in what we would consider a quote unquote crisis, of what we would typically think of that. But crisis truly is self-defined, and this is available 24/7. 365. And so whether it's 2 a.m. or 2 p.m., there is someone that is available to be able to support through those moments. And that is what I have today around grief.
Let's see if there's any questions. There was a lot to digest in here, a lot.
There's a lot of
Miles?
information.
Yes,
Yeah.
but thank you. Miles?
Yeah, thank you, Cheryl. Brooke, that was very helpful, and thank you very much. I really have two questions. The first is, at Pathways, what kind of support groups do you have, and what are the prices for those support groups for the public to attend?
Yeah, great question. We have Group is called On Our Own. That meets once a month, and it is for someone who have lost a spouse or a partner. So that support group is kind of focused in terms of the people who attend and their unique experiences. That is a donation-based group. So it is a drop-in style group as well. So you just register and you can drop in anytime that it occurs on that monthly basis. We also have a men's group that meets once a month as well. That is also a donation-based group and meets monthly. We also have a closed therapy group that meets, it runs once a month, but it's for 4 weeks. It's called Living with Loss, and that is $60 for all 4 sessions. And we also have a anticipatory specific group that is for caregivers, which is our caregiver support group, and that is virtual because we know that when you are a caregiver and you are experiencing anticipatory grief, being able to leave the home is not always something that is feasible. And so we wanted to make sure that that's being offered for our caregivers who might not be able to step out. And then we are, I think, in the process of creating just a general grief support group. So that is on the horizon for us as well.
Thank you.
Mhm. And all the registration we have is online, or you're always welcome to give us a call. And our administrative assistant, her name is Deirdre, can help kind of navigate anything that comes up.
I don't see any questions in the
Oh,
chat.
wait, oh, hold on.
Oh,
I have
okay,
a
Stacy.
resident here who wants to
Oh,
say
great.
something.
Okay, go ahead.
I don't really have a question. I thank you very much. I have had grief therapy after my mom's passing, but there was still a couple of things here that you said that will be very helpful in the future. And so I appreciate your time.
Yeah.
Yeah, thank you.
Appreciate your time.
Yeah, I definitely agree. I've been through my own grief, and some of this stuff it would have been nice to hear right off the bat, right? But I
Yeah.
might have not been at a place to receive it too. So it's just nice that this information's out there, and
Right.
it was a really good presentation. Thank
Thank you
Brooke.
very much.
Yeah,
Thank you.
thank
very
you.
much.
Brooke? With the anticipatory type of grief, because someone is ill or whatever the situation, is that of any and you can have time, I guess, to prepare some ways. Is that does that minimize the grief process in the end? I mean, we can't always anticipate because, as you said, it could be sudden. But I'm just wondering if, and every grief level is different for everyone, but being able to prepare or anticipate it, does that have any bearings in terms of how much grief somebody might feel?
Yeah, it's definitely hard to predict, right? But when we are experiencing anticipatory grief, I think it also allows us an opportunity to engage in pieces that are meaningful and
Mhm.
conversations that we feel like need to happen, to be able to engage in reconciliation, to engage in discussion that we put off. For whatever the reason might be, it allows us an opportunity to have some answers that we might not have had. And so a lot of times within complicated grief or disenfranchised grief, we were never able to have those conversations. And so we never know those answers.
Yeah.
And being able to have those answers or those conversations that we feel like we need to have beforehand can reduce the risk of complicated grief in my experience. It can really vary. It's so complicated and complex. And within kind of anticipatory grief too, it's almost like two losses because we're grieving the loss and then the loss occurs. So it can be a little bit longer, but in anticipatory grief, there's so much skill building around coping skills and ritual and routine that we try to build into that anticipatory grief process that it provides that support when we are experiencing those symptoms of grief, to be able to navigate those better.
Interesting. Yeah. Very good information on so many levels and things that I didn't expect to hear, so it was all very inciting and educational. So, and thank you for Pathways for being able to do these community education programs. It's very beneficial.
Yeah, thank you so much for having me and for the questions and letting me be present today.
Of course. Thank you, everyone, for coming today, and we'll see you next month in August 20th for our August Lunch and Learn. So everyone be well. Thank you. Bye.